Dr. Rajri, what are the 10 most damaging things that people are doing or possibly consuming when it comes down to gut health?
Okay, so I think the first thing is actually just eating foods that you're allergic or sensitive to. So if you're eating something every day, but you're allergic to it, it's going to cause a lot of inflammation in your gut. So I always recommend finding out what you're allergic to by doing an allergy test. And I recommend the basic IgE food allergy panel, which you can get at most standard labs like Quest Diagnostics. So you can ask your doctor to order it, or you can actually self-order the test. And so sometimes we'll find very common allergies that are positive, something like almonds that someone's eating every day, like drinking almond milk every day, but they're not noticing the connection between that almond milk and the abdominal discomfort they're experiencing on a regular basis.
Now, this is quite different from like a food sensitivity test that people might order, right?
Now, after today's video, I put a link down below for Seed Daily Synbiotic. If you're trying to change your diet up, I would recommend you add a good quality probiotic or at least some good fermented foods in if you don't go that route. But Seed is a unique probiotic because it has a prebiotic and a probiotic in one capsule. So you see there's two sort of capsules in one. So it breaks down in different areas of your gut, so you have a better likelihood of proper colonization of the bacteria in the lower part of the intestinal tract where you want the bacteria to colonize. So Seed is super unique with how they're built, but also it's the only probiotic that I personally would recommend. I think most probiotics are garbage because they all break down in the hostile gut. So Seed is unique, and I definitely recommend you check them out. And that is a 25% off discount link for people that watch this channel. So again, 25% off in the top line of the description underneath this video.
I'm not a big fan of the food sensitivity test, just from my experience ordering them in the past. They're very controversial. They're not accepted in the medical community. And they actually can be positive just based on what you're eating. So I feel they cause a lot of anxiety for patients because then they think they can't eat all of these foods. So rather, I like the very valid test, the IgE food allergy test. Now, there's always a chance we're not going to find anything on that test. So in that case, I recommend do a trial of elimination. So if you're having gut symptoms, try eliminating the two most common food sensitivities, which are gluten and dairy. So again, gluten sensitivity is very common, affects 8% of the population. And so I've noticed that when patients with gut issues specifically cut those out, like bread, pasta, and anything with gluten, they typically will see improvement in their symptoms, and then they can decide if they want to try it again. Same thing with dairy. So dairy sensitivity is very common. Sometimes it's due to lactose intolerance, but then it could also be due to sensitivity to the proteins in dairy, which are casein and whey. So again, those could be culprits for gut inflammation. So when people cut out the gluten and dairy from their diet, we typically see a lot of improvement in IBS symptoms. And so I think that's a huge part of what could be affecting the gut.
Totally.
Yeah.
All right, so if we move on to number 2, what would you say the second most important thing?
The second thing would be antibiotics. So antibiotics are prescribed very heavily, and sometimes they are necessary. So obviously, if you have a serious infection, you might need antibiotics to clear it. But I think they are overprescribed, and sometimes people just go to urgent care with a cough and a sore throat, which is most commonly, viral. It's just the common cold, but they're still given antibiotics. And so antibiotics can do a lot of harm on the gut microbiome because they kill not only the bad bacteria, they're going to kill a lot of good bacteria in the microbiome. And it can actually take months to sometimes years for those good bacteria to repopulate. And sometimes they never really repopulate, and it never really goes back to the pre-antibiotic state. So that's why I always tell my patients, if they do need to be on antibiotics, be sure to take probiotics to kind of protect their microbiome while on antibiotics. And a good example of this is I'll see it very frequently among my patients. When a woman takes antibiotics, 3 days later, they have a vaginal yeast infection. Again, because the antibiotics threw off the gut microbiome, allowing yeast to overpopulate, and then that threw off the vaginal microbiome.
Interesting.
Yeah.
So if someone has to do a course of antibiotics, you recommend the probiotics after the antibiotics? I mean, because are the antibiotics just going to kill the probiotics anyway?
Great question. So no, I actually recommend it during.
Yeah.
So take the probiotic first thing in the morning on an empty stomach to kind of colonize your microbiome and protect it. And then take the antibiotics after food. So that hopefully the antibiotics, although it is killing some of your good bacteria, you're also repopulating constantly on a daily basis, so it doesn't wipe it out, leading to dysbiosis and like fungal overgrowth.
Any benefit to sort of coupling probiotics with prebiotic foods? I mean, is that shown to kind of help populate some more of those probiotics that you're taking in?
Absolutely. And so prebiotics are like the foods to feed the probiotic.
Mm-hmm.
So again, eating diverse vegetables is always a good idea. So prebiotic foods are like bananas, artichokes, asparagus. Those are all rich in prebiotics, even garlic and onions. Fermented foods are also great. So in case you don't have access to probiotics, then at least get some non-dairy yogurt or kefir or some sauerkraut or kimchi. Again, they have a lot of natural probiotics in them.
Gotcha.
Yeah.
Okay, so we've got probiotics. What's going to be next? Antibiotics. What's next?
Okay, the next thing is sugar. So sugar is so prevalent in the standard American diet. And they say that the average American eats 17 teaspoons of added sugar every day. And it's pretty much in everything. You have to read labels so carefully looking for grams of added sugar because it can be in yogurts, soups, granola bars. It's pretty much in everything. So the issue is that the sugar is feeding bad bacteria and yeast in the gut microbiome. So it's leading to this epidemic of dysbiosis and fungal overgrowth in the gut. And then the issue is that once you have that, these organisms then hijack your cravings, so then you crave more sugar.
Yeah.
So
what did you say the upper limit would be for most people if they're trying to watch their sugar intake for
Great
this
question.
particular reason?
I think in an ideal world, if you can get it down to less than 5 grams of like refined additional sugar, so that doesn't count sugar from fruit, not naturally occurring sugars, but as far as additional refined sugar, keep it under 5 grams.
Is there a link between sugar intake and like candida? I mean, things like that?
I think absolutely. And that's why part of the treatment for candida is we have to reduce the sugar intake in the diet and increase the intake of leafy greens to counteract that. Yeah.
All right. Moving right along. What would you say number 4 is?
Okay, so the next one is actually going to be artificial sweeteners. So while you're trying to avoid sugar, you really don't want to replace it with the artificial sugars, especially like things that are labeled as sugar-free or like no added sugars. Those are kind of warning signs that they probably have some kind of artificial sugar. So for example, a lot of things are made with like erythritol, sorbitol, mannitol, which are like sugar alcohols. And so for some people, these can get fermented in the gut and it can feed some bad bacteria and lead to digestive issues and bloating because they're designed so that you cannot absorb them, but they stay in the gut. So then the bacteria there can start fermenting them. And same thing, a lot of diet sodas have aspartame, which is so bad for the gut as well. So really the only safe sweeteners that we know of are stevia and monk fruit.
And even with those, I mean, it can trigger some people to kind of have this additional cravings and whatnot. What's your take on honey? I'm curious, like honey as an added sugar, as an quote unquote added sugar, or, do you consider it a viable replacement?
Yeah, so whenever it comes to like making healthier versions of desserts, my preferences are always like natural sweeteners like maple syrup and honey. Again, because they have a lot of trace minerals. It's not just the sweetener, but you get those additional benefits. And honey, for example, it has immune boosting benefits. If you get local honey, sometimes it can help with allergy symptoms. The only thing I would say is that they still have an impact on blood glucose and insulin. So it kind of depends. If you're someone without insulin resistance, it may not be an issue. But if you're a diabetic and you're adding lots of honey into your tea, that could be an issue. So the quantity might matter. And then honey, I've noticed, because it's high in fructose, it can sometimes be a trigger for bloating and gas issues for some patients.
Yeah, that would make sense.
Yeah.
Okay, what would you say number 5 is?
Okay, so the next thing would be the constant snacking. So this is a big one. I think the constant snacking, where people are reaching for a snack every 2 hours, is leading to the epidemic of bloating. So the truth is, our small intestine really needs time to digest and process the food. So it typically needs about 4 to 5 hours between meals to really clean out. And we actually have this thing called a migrating motor complex, which is these waves of peristalsis in the small intestine. And so that process takes a couple hours. But if you're constantly snacking, you're never really going to clean out your small intestine, and that can lead to a lot of bloating. It can contribute to a condition called SIBO, small intestine bacterial overgrowth. So that's why I always recommend my patients, especially those with gut issues and bloating issues, to practice meal spacing. So that's where I advise them to separate their meals by 4 to 5 hours. And if they can, separate their dinner and breakfast by a minimum of 12 hours. And if they can go longer and do intermittent fasting, sometimes that can be even more beneficial.
Any benefit to potentially go longer? I mean, is there added benefit from a digestive standpoint for, pushing the fast, 20, 24 hours plus?
I would think so. I think absolutely. I think the main thing is just managing the blood sugar and seeing how the patient responds to that fast. I don't know that everyone can easily do that. But I think certainly that would activate all the autophagy, the self-eating, and cleaning up the GI tract tremendously. And I think that's why when people go on fasts where they just have broth or just some fluids or electrolyte powder, they feel so much better. Their bloating is significantly improved.
Yeah, makes a lot of sense.
Yeah.
All right, moving right along. What would you say number 6 is?
Okay, so I think the next one is excess alcohol. So alcohol is bactericidal, meaning it kills bacteria. That's why, like when you get your blood drawn, they wipe down your arm with the alcohol swab to kill all the bacteria. So if you drink alcohol, especially excessive alcohol use, it's going to kill a lot of the good bacteria in your gut. And then the other thing is that alcohol turns into sugar, especially like beer and wine. They have a lot of sugar, so that could contribute to feeding some of the bad bacteria and potentially yeast in the gut microbiome. And then alcohol definitely can be a trigger for acid reflux and heartburn as well.
Yeah. Are there, any, also when you start looking at like the various forms of alcohol, do some people have direct digestive issues with alcohols derived from grains versus hops, things like that? Like, do you notice any specific difference, or is it really just like once it's gone through the fermentation of becoming alcohol, the root sort of product that the alcohol is distilled from, does it even really matter?
That's a great question. I know, like, for example, with celiac disease, they can't have any alcohol that's fermented from wheat products. But I think in general, just excess alcohol consumption is harmful to the gut microbiome.
Yeah.
And for other reasons too. It's, a neurotoxin. Your liver has to process and detoxify it. It's dehydrating. It negatively impacts sleep. So there's so many reasons why it can be harmful to the health, especially in excess.
Yeah.
Yeah.
All right, number 7. What's next here?
Okay, so the next one is non-steroidal anti-inflammatory drugs, also known as NSAIDs. So that includes like ibuprofen, Motrin, Aleve, naproxen. So these are all the common over-the-counter pain medications that people use for like headaches and lower back pain and menstrual cramps. So it's funny because they're titled non-steroidal anti-inflammatory drugs, but they're actually inflammatory on the gut. So they can cause gastritis, they can cause stomach ulcers, duodenal ulcers, and they can also affect the permeability of the gut, leading to leaky gut. And especially if someone takes them on an empty stomach, then they can cause even more harm. So that's why sometimes for my patients with gut issues, I encourage them to minimize the NSAIDs, and if absolutely necessary, use acetaminophen or Tylenol instead.
And so it's the COX-2 that it's essentially affecting, that's kind of affecting the lining, right?
Exactly. So it actually affects the production of those protective prostaglandins in the stomach, and that's what can lead to the ulcers. Yeah.
So if you're someone that has to take those continually or should never probably take them continually, but if you're someone that has to take them for an acute injury or something like that, there are those times when an NSAID comes into play.
Yeah.
What would be a way to protect yourself?
Great question. So I would say absolutely take it after a substantial meal. That's probably the best way to protect yourself. Never take it on an empty stomach.
Any other things that, if someone's getting to a point maybe in their recovery where, okay, now I can start coming off the NSAIDs, anything that they can take to kind of continue sort of that, cyclooxygenase enzyme sort of downregulation without bringing in an NSAID?
Great question. Well, I'm a big fan of the topical NSAIDs. So you can get like diclofenac topically, even over the counter. So the topical NSAIDs, like if you have a localized area of pain, like your elbow's hurting, you can just buy the topical NSAID and apply it on that area so that it's not going through your gut at all.
Yeah.
So,
okay. All right, what's next?
Okay, so the next is eating too quickly or when stressed. So I think a lot of people are just kind of eating on the go because of all the stress that we're under. People aren't really sitting down for meals anymore. And the problem is that in order to have proper digestion, you really have to have your vagus nerve activated. So the vagus nerve is the one that controls the parasympathetic nervous system, which helps you rest and digest. So most people are just eating like on the go in front of a screen or in their car. So they're in a state of fight or flight. And I think that really impacts digestion. And so that's causing more acid reflux, more bloating. The food isn't being broken down properly. And also the motility in the gut's being impacted as well, leading to constipation and things like that. So I think just really slowing down and eating the food mindfully can make such a difference on digestion and on gut symptoms as well.
Can drinking like too much water with a meal impact things? You hear people talk about that. Like, does that dilute acid to a point where or is that just kind of really not an issue?
That's such a great question. I think it's really patient specific. But for some of my patients who, again, suffer from the low stomach acid, so low stomach acid is something we're seeing more of. We call it hypochlorhydria or achlorhydria. These are the people with burping and belching. Mm-hmm. Sometimes they have to supplement with stomach acid pills, which we call betaine and pepsin. Or they have to supplement with digestive enzymes. Sometimes I've noticed that it's helpful for them to eat their meal and then just take their enzymes and supplemental acid pills with just, like 2 sips of water. Yeah. And then give it like 30 minutes or so before they drink their water with all their vitamins.
Got it.
Because I think some people, they eat their meal and then they have to swallow all their vitamins and then they're diluting all their acid with a large glass of water. Mm-hmm. And that could potentially, again, affect the digestive process. But everyone's different. Some people can do it just fine.
Totally.
Yeah.
All right. What do we have next?
Okay, so the next one is eating the exact same thing every day. So, for example, if you're eating just green beans every night for dinner, and that's your only vegetable, and that's the only vegetable you like, that could mean that you're going to have a very narrow gut microbiome because you're only going to be feeding a certain type of bacteria. So it's really helpful to really diversify your diet, try different vegetables, incorporate things you don't normally eat, like purple cabbage and squash and artichoke, asparagus, beets, because the more diverse your diet, the more diverse your gut microbiome is going to be. And then the diversity really strengthens the microbiome so that, you're not prone to dysbiosis and overgrowth of bad bacteria and yeast as well.
So if you're, are there any risks of developing, intolerances, or do the intolerances sort of just come as a result of maybe having that narrow microbiome? So it's if you're just eating the same thing over, you hear people talk about this all the time.
Yes.
I ate so much of this, it got to a point when I started eating it, I started having problems with it. Mm-hmm. I'm more inclined to think that that's probably coming as a result of maybe not having as diverse of a microbiome than developing an actual IgE response to a given food.
Absolutely, yeah. So we have different microbes in our gut that are responsible for breaking down different things. Mm-hmm. One great example is a bacterial species called Oxalobacter, and it's a bacteria that breaks down oxalates. And we're hearing so much about people nowadays being sensitive to oxalates. Oxalates are the compounds that is present in spinach and chard and also in almonds. Mm-hmm. So for some people who do not have this bacteria in their gut at all, they're actually higher risk of developing kidney stones if they eat high oxalate foods. And they're finding that in the United States, people have are less colonized with this bacteria. And the thought is it has to do something with the antibiotic exposure. So that's something I look at with my patients on their gut microbiome tests. I always observe what's the oxalate level? And I'm noticing a correlation with the absence of Oxalobacter and their intolerance to some of these vegetables.
Interesting.
Yeah. And they say that if you go without eating these leafy greens for extended periods of times, so this is one of my concerns maybe with people who are on the carnivore diet for an extended period of time, is that the thought is if you don't eat any foods with oxalates for weeks to months, if you have the Oxalobacter in your gut, it probably is not going to survive, and you may potentially have difficulty reintroducing those foods later on.
That would make sense.
Yeah.
Yeah, the body has an interesting way of dealing with what you're consuming.
Yeah.
What would you say is next?
Okay, the last and final one is the long-term use of proton pump inhibitors, which are PPIs. Yeah. So PPIs are acid suppressive medications, and sometimes they are necessary. Like if you have a stomach ulcer, then you probably need to take it to heal the ulcer. Or if you have H. pylori, sometimes it's used as part of the treatment for H. pylori. But the problem is now PPIs are over the counter, so some people just purchase them on their own without a doctor's guidance, and they take them long term. So the problem is that when you take a PPI long term, you're basically shutting off all the acid in your stomach, and then it can affect your entire gut microbiome. It basically has a domino effect, because without the acid in your stomach, you can't break down proteins the same, and then you can allow certain bad bacteria and yeast to overpopulate in your gut. So that can actually lead to dysbiosis, as well as SIBO, which is small intestine bacterial overgrowth. And then even more concerning is it can affect your absorption of some key minerals like calcium, magnesium, iron, and zinc. And the research is showing it can put you at higher risk of osteoporosis and hip fractures. And even there was a study published in Neurology showing that it's now associated with the higher risk of dementia as well.
Interesting. Any suggestions for people that currently find some comfort when they take a PPI? Like it helps them, deal with maybe some moderate symptoms. Is there anything that people can do from a more natural perspective that, hey, like maybe you don't need to go this far, but maybe here's a suggestion instead?
Very good question. So what's interesting is if you're on a PPI for a while, like a couple weeks to months, you might actually find it hard to go off, because the way the drug works is it actually increases the level of a hormone called gastrin. And so if your gastrin levels are really high, and because you were on the PPI and you take the PPI away, the gastrin is going to tell your stomach cells to now produce a flood of stomach acid. So that's why some people just feel they always need to be on it. So what I do with my patients who are on PPIs who want to get off is I actually transition them to an H2 blocker. So like famotidine, which is Pepcid, and have them take that twice a day, because that's not as strong. And then after a week or two, they can take it once a day. And then they can start transitioning to more natural things. So I like to use DGL. So DGL is a type of licorice. And sometimes it's combined with other things. So for example, in my practice, we use a DGL that has the licorice, it has aloe vera gel, and it has slippery elm. And it can be taken anytime for symptoms of acid reflux.
Interesting.
Yeah, or I'll have patients drink some organic aloe vera juice without any added sugars or preservatives, and that just coats the esophagus and gives them relief of their heartburn.
That's a good solution.
Yeah.
Well, Doc, where can everyone find you?
Oh, thank you. Yeah, so I work in Fullerton in California, and my practice is called OC Integrative Medicine, and you can also find me online. My YouTube channel is Rajshri Nambudripad, MD.
Great. Thank you so much.
Thank you so much.